Hello again. Justin Owen here, your friendly neighborhood neurosurgeon with Disc of Louisiana. Feeling kind of ambitious as we're starting to see some return to a semblance of normal life, and thought that I would try and tackle a deceptively tricky question that I get asked a lot.
Dr. Owen, can you explain minimally invasive spine surgery, the 1-inch incision with the Band-Aid?
All right, to answer this question, let's deal first with the spine surgery part of it and leave the minimally invasive part off to the side for just a moment. Spine surgery is not magic, it's carpentry or sculpting, if you will. The ways that the spine can cause problems can be very complex, and then the ways that we have to try to fix those problems can be equally so. Any given patient doesn't get better just because they get some random spine surgery. They get better if and because they get the right spine surgery. And that's really the challenge that we face every day. It's what is the right surgery for a patient? What is the carpentry that they need to make them better? And there are a lot of options. Saying spine surgery is a little bit like saying cars or ice cream. There are a lot of different choices, a lot of different kinds, and they're not all created equal. So there's a lot of decision making and consideration that has to go into what truly needs to be fixed and then how to go about fixing it.
Okay.
All right, so if I was the great Dr. Leonard McCoy from Star Trek, I'd just get Scotty to beam the problems out of my patient's spine and then beam in the stuff that I wanted to put back in. And that would be super nice. But we live in a reality where transporters have yet to be invented, and that leaves us with something of a challenge. We have to physically get to and from the spine in order to do whatever carpentry needs to be done to fix whatever needs fixing.
Logical.
Right. So, at Disc of Louisiana, we believe that the outcome of spine surgery does not only depend upon what's done to the spine, but also on what's done to the rest of the body, and that the access to the spine is important in its own right towards getting the end result, which is quality of life. And we want the best end result. So we carefully consider every aspect of a surgical plan, try to maximize the benefits, to try to get the maximum benefit from the surgery while minimizing the undesired effects. And that is the essence of minimally invasive spine surgery. It's about efficiency. It's about smaller incisions, as small as possible to get the desired result. Sometimes that's a 1-inch incision and a Band-Aid, and sometimes it's much smaller than that. Sometimes it's 2 or 3 small incisions that are strategically placed instead of one gigantic incision, much the same way that a lot of laparoscopic surgeries have replaced big belly incisions for things like gallbladder removals. But what we've been able to accomplish with these minimally invasive techniques is truly remarkable. Less pain, faster recoveries, lower risk, less medications, shorter hospital stays, better results, better outcomes, time and time again. Surgeries that used to keep patients in the hospital for days, we can now do as an outpatient. We can do fusions on patients today and then watch them leave the hospital tomorrow feeling better than they have in years. It's very cool. Whoa. Anyway, I hope that answers any questions that you may have had about what minimally invasive spine surgery is. Any other questions, please leave it in the comments or call the number on the screen. As always, I remain your friendly neighborhood neurosurgeon, signing off for now. Live long and prosper.